Here's something to really wrap your head around. In 2022, nearly 2 billion people in low and middle income countries lacked adequate social protection.
Wow.
That's coming from a recent World Bank report just out around April 7th, 2025. Nearly 2 billion. That's where our deep dive starts today.
It's just, the scale of that number is immediately striking, isn't it? We're talking about a massive chunk of the global population in a really, really tough spot.
Exactly. So for you listening, what we're aiming to do here is unpack what adequate social protection actually means. We'll look at the sheer scale of this gap, globally and regionally, dig into the core reasons behind it, and importantly, why this should matter to you.
Yeah, why it's relevant.
We've pulled from a few key places, the World Bank report itself, of course, but also info from the International Labor Organization, the ILO, and various articles and research reacting to all this.
Right.
The mission is basically to distill the crucial insights, so you can get a real handle on this major global issue without drowning in, endless data points.
Trying to connect the dots, make it clear what the situation is and what it really implies.
All right, so let's get down to it.
Right.
What does adequate social protection mean? It sounds like it's more than just, having some kind of safety net.
It really is. The World Bank report zeroes in on this quite specifically. They look at the poorest 20% of people in these countries.
Okay, the very poorest.
Exactly. And they say protection is inadequate if the benefits someone gets are less than 20% of the relative poverty line.
And that line is based on?
It's based on the typical income or spending of people around that same low level, sort of the 20th percentile. So the point is, someone might technically be in a program.
Right.
But the support they receive is just too low. It doesn't actually lift them significantly or protect them from hardship.
Okay, so depth matters just as much as breadth, especially for the most vulnerable. Now, I know the International Labor Organization, the ILO, they have a perspective too, maybe slightly different.
Yeah, they do. The ILO talks about universal social protection floors. It's a concept rooted in, human rights, outlined back in a 2012 recommendation.
Human rights based, okay.
Their vision is that everyone, universally, should have a guaranteed minimum level of social security. That means essential health care and basic income security across their whole life. It's really about a fundamental safety net for absolutely everyone.
So let me see if I've got this. The World Bank is kind of measuring if the poorest get enough help.
Essentially.
While the ILO is pushing for a minimum baseline for all citizens.
That's a good way to put it. Different angles on a related challenge.
And when we talk about social protection generally, what kinds of things are usually included?
Typically, it falls into three broad categories. First, you've got social assistance.
Okay.
These are generally non-contributory, funded by taxes or aid, usually targeted at the most vulnerable groups. Think cash transfers, food aid, that sort of thing.
Got it. Non-contributory.
Second is social insurance. This is the contributory model, often linked to employment. Employees and employers pay in, and it covers things like unemployment, sickness, disability, pensions.
Like pensions, right.
And the third pillar is labor market programs. These are designed to help people find work or improve their employability.
Yeah.
Think job training, job search assistance, maybe some wage subsidies.
Okay, that framework helps a lot. Assistance, insurance, labor market programs. But the report mentions it's actually quite tricky to measure and compare social protection properly across countries. Why is that?
Yeah, there are several real challenges there. For one, countries just define social protection differently, and the programs themselves vary hugely in design and scope.
Makes sense.
Then there's the data problem. It's often really hard to get reliable data, especially on people in the informal economy, which is massive in many of these countries, or migrants, or people in very remote areas. So you might be undercounting the gaps.
Right, the data just isn't always there.
And as we just discussed, there isn't one single globally agreed upon definition of what adequate truly means. That obviously makes direct apples-to-apples comparisons quite difficult.
Okay, so bearing those definitions and measurement challenges in mind, let's circle back to that huge number. 2 billion people lacking adequate protection. Can we break that down a bit more?
We can try. It's almost hard to visualize, but yeah. Of those 2 billion, a staggering 1.6 billion have no social protection coverage at all. Zero formal safety net.
1.6 billion with nothing. Wow.
And then there's an additional 400 million who might be enrolled in some kind of program, but the benefits are so low they're deemed inadequate by that World Bank measure we talked about. Not enough to truly help them cope or escape poverty.
And I imagine this isn't evenly distributed across the globe.
Not even close. The situation is most severe in Sub-Saharan Africa. Over 70% of the population there lacks any social protection coverage.
Over 70%.
And if you drill down into the low-income countries within Sub-Saharan Africa, the average coverage is only about 9%. Just think about that the vast majority are completely exposed.
That's incredibly stark.
Ah.
What about other income groups or regions?
Well, low-income countries globally face a similar picture. Over 80% are either inadequately covered or have no access.
Okay.
And a really worrying point is that only about a quarter, maybe 25% of the very poorest people in those low-income countries have any coverage.
So the system isn't reaching those who need it most there.
Precisely. In lower middle-income countries, it's a bit better, but still, over 30% are inadequately covered and more than half have no coverage at all.
Still huge numbers.
Yep. Upper middle income countries do better on percentages, around 11% excluded and 6% getting inadequate support. But because these countries often have very large populations, those percentages still translate into millions and millions of people without proper protection.
So geographically, where are the biggest concentrations?
Over 1 billion of these inadequately covered people live in Africa and South Asia. That's where the sheer numbers are largest.
1 billion just in those two regions.
Yeah. Now, South Asia has seen some progress. Coverage there apparently went up from around 9% in 2009 to about 24% by 2023.
Okay, that's movement.
It is positive movement, absolutely. But it also underscores just how big the remaining gap still is, even with that progress.
And it really hits home that the people living in extreme poverty, the most vulnerable, are disproportionately left out.
That's one of the most troubling findings. Globally, 88% of people in extreme poverty lack adequate or any social protection.
88%.
And in low-income countries, it's 98%. In Sub-Saharan Africa, 97%. The systems are fundamentally failing to reach the people at the very bottom.
Now, the report did mention some overall progress between, 2010 and 2022?
Yes, there has been some. Across the 73 countries they track consistently, the share of people getting some form of social protection did rise, from about 41% to 51%.
Okay, so a 10 percentage point increase over 12 years.
Right. It's moving in the right direction, but you have to ask if the pace is nearly fast enough, given the scale of the need we're talking about.
Good point. And where was that progress concentrated?
Mostly in social assistance, things like cash transfers, food aid. That's where the biggest expansions happened.
And less so in other areas.
Much less so in social insurance, like pensions or unemployment support. Coverage for those remains minimal in low-income countries, only about 2%. And it's still low, just 8% in lower middle-income countries.
There was a table 1, that broke some of this down by income group. What were the key takeaways there?
Yeah, Table 1 really paints the picture starkly. Low-income countries, effective coverage around 13.7%, poorest quintile, maybe 25% covered, public spending on it, just 4.4% of GDP.
Very low.
Extremely low. Old age pensions cover just over a quarter, child benefits under 8%. Now contrast that with lower middle income countries. Coverage jumps to nearly 38%. Spending is up to 6.5% of GDP. Pensions cover 2/3, child benefits about a quarter.
A significant jump.
A very significant jump. And then upper middle income countries. Coverage nearing 47%, spending over 10% of GDP, pensions cover over 83%, child benefits almost 30%.
So the link to national income is incredibly clear.
Absolutely crystal clear.
Yeah.
While the table doesn't give the poorest quintile figures for the middle income groups, the report suggests it's better than in low income countries. But the overall pattern is undeniable. Richer country, generally better social protection.
Which leads us right into the why. Why does this massive gap exist? It seems strongly tied to a country's economic level.
That's definitely a primary driver. The report makes that connection very clearly.
Yeah.
Low-income countries consistently lag. They face huge fiscal constraints, smaller tax bases, less government revenue overall.
Right.
Plus, they often lack the robust infrastructure needed, the administrative capacity, the delivery systems to run complex nationwide programs. And there are always competing priorities for very limited public funds, health, education, infrastructure.
It all competes for the same small pot of money. And the actual cost of closing this gap must be a major barrier.
It's absolutely massive. The report estimates the funding gap for providing just a basic social protection floor across all low and middle income countries is about 3.3% of their combined annual GDP.
3.3% combined. How does that look for the poorest countries?
That's where it gets truly daunting. For low-income countries alone, the gap is estimated at 52.3% of their annual GDP.
Wait, over half their GDP?
Over half their entire economic output, yes. In dollar terms, that's an extra US $308.5 billion needed per year, just for those countries.
That sounds almost impossible.
It highlights the scale of the challenge. Overall, for LICs and MICs together, it would mean boosting government spending by about 10.6%. But for the LICs specifically, they need to mobilize resources equivalent to 4 times their current total annual government expenditure. It's a monumental financial hurdle.
Wow. Okay, beyond just the money, what about the structure of their economies? The report mentioned the informal sector.
Yes, the large informal sector is a huge complicating factor. Most traditional social insurance systems, pensions, unemployment, are built around formal employment, right? Regular paychecks, employer contributions, employee contributions.
Better contracts, yeah.
Well, those systems just don't easily reach the millions working informally. Street vendors, smallholder farmers, domestic workers, gig workers, they don't have those formal arrangements or stable incomes. So you need different, more innovative ways to bring them into the safety net.
And it's not always just about not having enough money overall, is it? Sometimes it's about how the money is spent.
That's another key point. Priorities can be skewed. In many countries, especially lower income ones, a disproportionate share of social spending might go towards those formal social insurance schemes we just mentioned. Which mainly benefit formal sector workers and retirees, who are often relatively better off than, say, the informal poor or subsistence farmers. Meanwhile, social assistance programs, the ones more likely to reach the very poorest, often get a smaller slice of the pie.
So an allocation issue, and then there are governance factors.
Unfortunately, yes.
Yeah.
Weak governance can really undermine efforts. You're talking about inefficient use of the resources they do have. Maybe poor targeting, so benefits don't actually reach the intended people. Leakages, corruption, lack of accountability. All of these can divert funds or reduce effectiveness. And of course, political instability makes it really hard to plan and implement consistent, long-term social protection strategies.
And finally, the report points to vulnerability to external shocks. That seems increasingly relevant.
Absolutely critical. Things like major economic downturns, the accelerating impacts of climate change, droughts, floods, extreme weather, and, as we all saw, pandemics like COVID-19.
Right.
These shocks can completely overwhelm already strained systems. They push more people into poverty and increase the need for support, often exactly when government resources are also under pressure. Climate change alone is projected to drive millions more into extreme poverty by 2030.
And COVID really laid bare those weaknesses, didn't it?
It really did. It exposed the gaps in coverage and the lack of adaptability in many systems worldwide, highlighting just how crucial, resilient, shock-responsive social protection is.
Okay, so we have a pretty clear, if grim, picture of the problem, the scale, the reasons. What are the tangible consequences for people living without this protection?
Oh, they're devastating, and they ripple outwards. At the individual level, it's fundamentally about increased poverty and destitution. Lacking that buffer means a job loss, an illness, a crop failure, or just old age can plunge someone into crisis. This leads directly to things like food insecurity, malnutrition, especially hitting kids, and the elderly hardest. It means poorer health outcomes because people can't afford health care or even transport to get it.
And education.
Education suffers too. Families might need children to work instead of going to school just to survive day to day. It basically leaves individuals and families constantly walking a tightrope, incredibly vulnerable to any kind of shock.
And these individual struggles, they must aggregate up to families and communities.
Definitely. It creates cycles of intergenerational poverty. Kids who have to work don't get educated, limiting their future, repeating the cycle. It can force families into desperate measures, like selling assets or taking on crippling debt.
And socially.
Socially, you can see an erosion of community ties, maybe increased stress and conflict within families and communities. Rising inequality and desperation can, in some cases, fuel social unrest.
And zooming out even further, to the whole economy, the macro level, what's the impact there?
It acts as a drag on development. If large parts of your population are unhealthy, poorly educated, and insecure, that hampers productivity. It hinders overall economic growth.
Makes sense.
High inequality and social exclusion linked to this lack of protection can also create instability, which isn't exactly great for attracting investment. It limits the development of human capital, your future workforce.
So it limits potential.
Exactly. It can also reduce overall demand in the economy because people are just focused on survival, not spending. And ironically, while it seems like saving money now by not investing in social protection, it can lead to much higher costs down the road, dealing with the long-term consequences of poverty, ill health, maybe even instability.
A sort of penny-wise, pound-foolish situation on a national scale.
You could certainly see it that way, yes.
So given this complex web of problems and consequences, let's turn towards solutions. What are the key recommendations coming out of, say, the World Bank report?
The bank highlights 4 main policy directions. First, just extending coverage, getting more people included, especially in those low-income settings. This means practical stuff. Investing in better social registries to know who needs help, using digital payments to get aid out efficiently, maybe integrating case management so people get coordinated support.
Okay, extend coverage. What else?
Second, strengthening adequacy. It's not just about if you get help, but how much. So increasing benefit levels, maybe making them last longer, so they actually make a difference. They also talk about tailoring support, especially in middle-income countries, to help people become self-reliant, linking benefits to job training or market access.
Building resilience, right. Third
is building shock-proof or shock-responsive systems, making sure these safety nets can actually handle crises. That requires better data, reliable payment systems that can scale up quickly, maybe early warning tools for climate shocks or economic downturns.
Makes sense. And the fourth?
Fourth is about optimizing what's already there, improving the targeting of benefits to make sure they reach the right people, cutting down on waste or leakage, basically ensuring you get the best value for money spent on social protection.
Okay, so coverage, adequacy, resilience, and optimization. What about the ILO's perspective on moving forward?
The ILO continues to strongly push for those universal social protection floors we mentioned earlier.
The human rights approach.
Exactly. And they emphasize that achieving this requires a serious long-term commitment to boosting domestic funding. That means things like increasing revenue from Social Security contributions where possible and implementing more progressive taxation systems.
Sustainable domestic funding.
Yes. They acknowledge it's a long haul, and for countries with really limited fiscal space, some temporary international support might be needed initially.
Okay.
And they have a specific target recommendation for countries to aim for at least a 2 percentage point increase each year in the share of their population covered for at least one major life risk, like old age, disability, or unemployment, if they want to meet the relevant Sustainable Development Goal, SDG 1.3, by 2030.
A concrete benchmark. It sounds like getting countries to raise more of their own funds is really seen as key for sustainability.
It absolutely is. That domestic resource mobilization piece is crucial. Beyond just tax rates, it's about improving tax administration, making collection more efficient and fair. It's about strengthening the collection systems for Social Security contributions, again, where that's feasible. And it also involves looking hard at existing government spending, like subsidies, especially energy or fuel subsidies, that often disproportionately benefit richer households, and potentially reforming those to free up funds for more targeted social support.
Redirecting funds. But given those massive funding gaps, especially in the poorest countries, international help still seems necessary.
Oh, undeniably. Increased and, importantly, well-targeted official development assistance, ODA, foreign aid specifically for social protection is vital, particularly for the least developed countries, helping them establish those basic safety net systems and build the institutional capacity to run them effectively over time.
Are there major global initiatives already working on this?
Yes, there are several important ones. There's the UN's Global Accelerator on Jobs and Social Protection for Just Transitions. Quite a mouthful, but its goal is ambitious. Extend social protection coverage significantly and help create millions of decent jobs by 2030. There's also USP 2030, which is the Global Partnership for Universal Social Protection. It brings together countries, international organizations, civil society, all focused on achieving that universal goal in line with the SDGs. And institutions like the World Bank itself have publicly committed to scaling up their own social protection programs and lending.
And technology keeps coming up. It seems like a potential game changer here.
It really does offer huge potential. We touched on digital payments, faster, cheaper, more transparent delivery of benefits.
Right.
Digital social registries can help identify and enroll eligible people much more efficiently than paper-based systems. And things like digital case management tools can help social workers coordinate different types of support for vulnerable families families more effectively. It's about using tech to make these systems smarter and more efficient.
The report also used some specific examples, case studies, to illustrate these points, right? Both negative and positive.
Yes, and those really help ground the discussion. On the cautionary side, they mentioned the 1984 Ethiopian famine. It stands as just a devastating example of what happens when a massive crisis hits a population with virtually no social safety nets in place. The scale of human suffering was immense.
A stark reminder.
And similarly, the 1997 Asian financial crisis. In countries like Indonesia, Thailand, South Korea, the relatively underdeveloped safety nets at the time couldn't cope with the sudden economic shock. It led to huge job losses, spikes in poverty, social unrest. Now, it is worth noting that some countries, like South Korea, actually responded to that crisis by significantly expanding their social safety nets afterwards. They learned a hard lesson.
Okay, so crises can sometimes spur action. What about positive examples, programs that have worked?
Absolutely. The report mentions conditional cash transfers, CCTs, in Nicaragua, the Red to Protection Social Program. Studies showed these had real positive long-term impacts, not just providing immediate relief, but boosting kids' education levels and even their later success in the job market.
Investing in the future.
Exactly. And another powerful example is the progress made in Rwanda and Ghana toward universal health coverage. These show that even in lower income settings, building effective social insurance mechanisms for health is possible. It dramatically increases people's access to needed care, improves public health overall, and crucially reduces the risk of families falling into poverty just because someone gets sick.
Real transformative potential there.
Definitely.
So, as we bring this deep dive to a close, what's the core message you think our listeners should take away from all this?
I think the central point is just how fundamental this issue is. This massive gap in social protection we've been discussing, affecting billions in low and middle income countries, it's not a niche issue. It's a critical barrier to global development, to human well-being, to achieving pretty much any other major goal, from reducing poverty to improving health and education, even promoting economic growth and stability. They're all interconnected.
It really underpins so much else. And what are the absolutely crucial steps needed to start closing this gap?
It really boils down to a combination of things. Strong political will and prioritization from national governments is number one. That has to translate into increased, sustained public spending. Then it's about smart design, gradually expanding social insurance where feasible, but ensuring robust social assistance reaches the poorest and most vulnerable.
And making sure it works on the ground.
Exactly. Strong delivery systems are key. Efficient, transparent, accountable. International cooperation, both financial and technical support, remains essential, especially for the lowest income countries. And finally, really leaning into the potential of technology to improve reach and effectiveness. It needs a concerted effort on all these fronts.
Okay, so finally, as we wrap up, maybe a thought for everyone listening to ponder. Just consider the ethical dimensions, but also the practical economic implications of having such a huge portion of our fellow human beings lacking even the most basic safety nets. What are the real long-term consequences globally if we don't manage to address this fundamental vulnerability? It's like, well, it's something worth thinking about.